Welcome to MenopauseWize, your go-to podcast for all things evidence-based in the menopauseverse. I am Dr. Supreet Patel, an MD gynecologist, a menopause health advocate, a postmenopausal woman, and the founder of MenopauseWize. And I'm so excited to have you join us on this journey. Whether you're a healthcare provider looking to stay on top of the latest evidence-based practices, a woman navigating your own perimenopause or menopause journey, or a partner or family member eager to support a loved one, this series is designed with you in mind. Our mission through MenopauseWize is to close the menopause knowledge gap by bringing you the latest research, expert insights, and practical advice, empowering you to make informed decisions about menopause and perimenopause. Welcome to today's episode of the MenopauseWize podcast on hair thinning and hair loss at menopause. Today, I'm excited to welcome Dr. Snehal Sriram, a senior dermatologist and trichologist with over 28 years of experience in skin and hair health. A gold medalist in her post-graduation and recipient of multiple prestigious awards, Dr. Sriram is a key opinion leader in cosmetic dermatology and trichology. She has led medical services for Kaya clinics across India and the Middle East and served as medical director for Tricha hair clinics. Dr. Sriram believes in a holistic, customized approach to hair and scalp health, integrating overall wellness with targeted treatments. In addition to dermatology, her areas of special interest include mind-body connections, telepathy, parenting, and spirituality. And in this episode, she shares expert insights on why menopause leads to hair thinning and hair loss, and more importantly, what is it that women can do about it? So thank you, Dr. Sriram, for joining us today, and welcome to our episode on this episode of the MenopauseWize podcast.
Thank you so much for inviting me. It's a pleasure, because when I'm going through the good work that you are doing at MenopauseWize, it's very important to convey the right information and separate myths from facts.
And that's the exact reason why we have you here. To provide some credible information on hair thinning, hair fall, because there are so many women with the same problem today, and options are confusing in the market. So thank you for doing this. And let's start with the very basic question. Why do women at menopause and perimenopause face hair fall and hair thinning? Why do so many women face this problem, and how do hormones play a role in hair health?
That's an absolutely important question to begin with. Let us simplify it a little more. So we have two kinds of hormones in our body. The male hormones, what we call androgens, and the female hormone, broadly we would call them estrogens. So in both male and female bodies, there would be estrogens and androgens. Now, in a woman's body, there would be predominant estrogens, female hormones, as opposed to male hormones. So they are always in a state of balance where male hormone activity is not at any point in time taking over the functions. However, around menopause and perimenopausal stage, your estrogen starts getting depleted, your female hormone starts getting depleted, and as a result, there is a relative, the weighing scale shifts a little bit, and now the androgen or male hormone effect starts showing up. And male hormones have this weird paradoxical property. They will thin the hair on the scalp and they'll increase the body hair. So typically, when the male hormones increase, hair thinning begins, and initially it's a very subtle one. It's not, you don't suddenly start seeing balding. However, subtle thinning begins slowly, insidiously over a period of time till you start seeing that your ponytail volume is lesser, the hair are significantly thinner, there are areas where you can see your parting being more visible, and then it goes on from there.
Understand. What about is there anything that I can do at this stage when I'm just observing that there is some amount of thinning? Are there any kind of over-the-counter hair products that I can use, or should I be? What is like a warning signal for us to take action? Because, as you said, it's not, you're not going to bald overnight, but Is it important to recognize it early, and what can I do if it is early enough?
Absolutely important to recognize it early. The reason is because the earlier you start treating hair loss, the better are your chances of retaining your existing hair. See, when we try to treat hair loss, there are two aims of the treatment. One of the aim of the treatment is to preserve your existing hair so that it does not, you don't lose hair further. And second part of the treatment is to work on regrowth of the hair that you already lost. Now, coming to uh, early action, what are the signs? You would find that your ponytail volume is lesser. Sometimes when you tie the clips, you will feel that there is a little bit of pain where you put your clips. You would see that you shed a little more hair than usual. Uh, there are other factors also that we need to watch out for. One of the factor, so before I get into those factors, there are three things I would really want to make it clear that hormones, while it triggers hair loss, there are other hair loss accelerating factors like nutritional deficiencies, like certain physical illnesses, like there are certain other drugs, other medications which can also increase hair loss. There are other psychological and mental emotional factors which would increase stress that would also increase hair loss. Why is this important? Because for your body, your hair is not important. It's not vital. Uh, on a A to, I mean, I'm simplifying this a little bit, but on a A to Z priority, your body, for your body, your heart, lungs, liver, kidney, brain, everything is important. Hair does not play a very vital role and it requires a lot of nutrients to grow. So, if there is any stress on the body, any nutritional deficiencies, any physical illness, anything else not going right with the body, your body will not prioritize hair. So, what happens? Blood supply nourishment is curtailed. It's like if your company is in recession, you would look at shutting down the least important department. This is similar for our body. So our body does not send blood supply nourishment to the root of the hair. Now the hair, which is hormonally predisposed to thinning, and now it doesn't get blood supply, it will start thinning much faster. So if we start noticing hair loss, we need to check for nutritional deficiencies, any other physical factors, any other illnesses, or even mental or emotional stress, and we need to treat those aspects also. So that's one thing that we need to understand, which is other hair loss accelerating factors coexisting with menopause and sometimes indirectly even connected to menopause. The emotional changes, the stress that comes in with menopause or perimenopausal stage will be also an indirect factor in addition to the hormones. Then, so that's one thing that we need to understand. Second thing, we need to understand our genetic or family history. Genetic tendencies for hair loss is pretty common. And in women, it is said that 30 to 40% of women would have some degree of genetic tendency for hair loss. So if you have a genetic tendency for hair loss, and need not be only on your maternal side, it can be anyone. It could be grandfather, uncle, anyone if they have a history of hair loss or balding, then it's important to start working on hair loss a little earlier. Now, what are the things that one can start doing? Look at your nutrition and lifestyle. Nutrition is an important aspect. Your hair is a very fast growing cell in the body. It requires a lot of nourishment. It would require proteins, it would require micronutrients, it would require a lot of water. A lot of time people don't correlate the water intake with hair growth. So, nutrition, water intake, and your lifestyle. Lifestyle in terms of working with your body and your mind. Working with your body means exercise, working on a non sedentary lifestyle. Working with your mind would involve de stressing, mindfulness, meditation, whatever works for that phase in your life. So when we work with body and mind, we are getting the circulation going and we are de-stressing. when we are working on the right nutrition, we are feeding your hair in addition to feeding your body. And when we drink enough water, water is a vital nutrient to carry the blood supply and nourishment to the roots of the hair. So when we do these three things, nutrition, water intake, and lifestyle changes, that itself will go a long way in preventing further hair thinning and also take care of the other hair loss accelerating factors.
Got it. And I feel like these are such important pillars whenever we discuss any part of menopause or any part of health. We keep coming back to the basic pillars of nutrition, exercise, hydration, sleep, stress, all of that. But very often we are looking for a magic pill. We are looking for that supplement which says hair, nails, and something on lying on a shelf, which may be helpful, I guess, because are those supplements then, do they make sense in a way, considering our nutritional requirements are not always met by food? Would
Yes,
that be something that you would recommend?
yes, supplements do make sense, and I do recommend different types of supplements for someone with hair loss. The reason, as you very rightly said, that your nutritional requirements are not always met by food because of multiple reasons. One is, it's not always like however balanced your diet is, it may not be always possible to consume that much amount of protein, that much amount of micronutrients, that much amount of omega-3. However, there is unfortunately no magic pill. A lot of in the market you find a lot of nutritional supplements which are touted as the panacea for hair loss, and I see patients, they will say that my friend has taken this and her hair loss is gone, and I've been taking it for now 6 months. There's nothing which has happened because there is no one single nutrient which would work. Generally, what I do is I give my patients what is called cyclical nutritional therapy. I would recommend a balance of macro and micronutrients. So the nutritional therapy is not, say, one biotin. I mean, biotin is really overrated. It doesn't work. It works, but it works in a limited quantum. It's not a magic pill, or it's not like a it's really not a magic wand. So typically, I would suggest proteins, amino acids, omega-3 fatty acids. I would suggest a combination of micronutrients, even a basic iron. So I find a lot of my patients, they will say, my hemoglobin is fine, doctor. There is no problem. And then when we test their blood, we find that, their ferritin levels, which is your iron storage, is low. Sometimes your serum iron levels are low. So they have what is called non-anemic iron deficiency. So even supplementing iron and folic acid, as basic as that, becomes important. And the reason why I believe in cyclical nutritional therapy, because see, if I add all the nutrients together, the absorption gets affected. Your body will absorb what it needs, and it will not absorb when there is when you take high dose over nutrients. So typically I would give things like, say, Monday and Thursday, take these two pills. Tuesday and Friday, take these two. Wednesday and Saturday, take these two. So one of protein, one of micronutrients. I would not combine iron and calcium. So if I'm giving iron and folic acid and vitamin B12 on Monday and Thursday, then Tuesday and Friday I would give calcium and omega-3. So generally, I would really recommend getting yourself tested for nutrient deficiencies, especially micronutrients like iron, ferritin, like vitamin B12, vitamin D3. Get yourself tested if possible and supplement those nutrients. Generally, I find that when my patients are taking one single pill, I do not see that degree of results unless the patient has that specific nutrient deficiency. Supposing you have B12 deficiency and then you are taking B12, then that makes sense. But otherwise, taking like how we need to take a balanced diet, similar, even the nutrient supplements need to be balanced and not overdone. That is what I would really recommend, and that is what would help. but that is not a substitute for uh, healthy diet.
Right.
That's that we need to really balance. In terms of diet, I generally would recommend that a slightly lower carbohydrate diet with good amount of proteins, omega-3, a lot of antioxidants in the form of raw salads, raw vegetables, fruits, etc., and enough
Mm.
water. That's a
Mm.
hair. However, another thing that's very important for your hair, in addition to omega-3, a small amount of saturated fats. So when I see, there are patients of mine who are on diet, which is really low fat diet. And they are looking at working on their weight, or for whatever reason they've been told to take a low fat diet. And then I find whatever we do, the hair remains a little rough, coarse, not smooth. That smooth and shine
Mm.
would come in when there is balance. And especially in perimenopausal and menopausal women, I would also give isoflavones, and assuming that they do not have hypothyroidism, etc., then soya isoflavones are good. I combine that with antioxidants. So there are these supplements that one can really do, and one can start off early so that the hair root is getting enough nutrients. That's
Mm.
something which possibly every menopausal or perimenopausal woman can start off with, understanding the nutrient profile, starting overall healthy diet, and some degree of supplementation, not over supplementing, but cyclically supplementing all nutrients that are needed.
Right, right. And I feel like you mentioned biotin, and it's amazing how it's just taken over the hair market. You see so many bottles, different kinds of bottles over the many different shelves, and everyone thinks it's a magic potion. And this attitude, I feel that the magic pill, what is going to change my hair fall, or that magic oil, is there? Is there a place for things like oils, and is there any recommendation that you would make to, because of course, like in India, oiling your hair is not very uncommon, or now it has probably become a little less common, but when we were younger, we always used oil, and there are a different variety of oils available. And what are your comments on the use of oil for prevention of hair loss or stimulating hair loss, hair growth? What do you feel about
So,
it?
so, uh, so oiling. Uh, now, oiling is not bad.
Hmm.
However, oiling is not going to solve the problem. Now, when I'm talking about oiling is not bad, generally my advice to patients would be, if you are in the habit of oiling, do not stop oiling. But if you are not in the habit of oiling, then starting to oil to prevent hair loss is really not going to uh, give you that kind of result. So typically let's understand oiling and benefits of oiling. When you apply oil, there are two parts of the benefit. One part of the benefit is the moisturization of your scalp, and second part of the benefit of the massage itself. So when we massage, there is that increase in blood circulation, there is a little bit of that feel good factor, some amount of de-stressing that happens if there is someone else who is massaging. I mean, not you yourself putting it. So there is that some amount of de-stressing that happens. Those are all good things. Now, moisturization really is not an important anymore, because none of us walk around with oil. So those who are even putting oil, they would put oil for an hour and then wash it off. And when they are washing it off, they'll use 2 times the amount of shampoo they would normally use to wash it off. So what happens? The hair becomes dry again, because they want the hair to be dry. They don't want the hair to be oily.
Mm.
Because a current modern standard of grooming, oiling is not an acceptable grooming standard to go out with.
Right.
So if it's not acceptable, you're not going to oil. So you're just going to apply massage. I mean, the same benefit of massage you can do if you do just dry massage or one of those peptide-based hair serums or one of those Redensil, Procapil, those type of serums you apply and just massage it. It's going to do the same thing. However, if you're in the habit of oiling, go ahead and oil. It's not that oiling is bad, but oiling is not going to give you some magic benefit. Now, there are certain elements. Now, since you talked about the types of oil, so there are certain which do have some beneficial effects. So one of the herbs is bringaraj. And there are other herbs which are associated, there are Brahmi and there is other antioxidants and like amla, methi, etc.
Right.
Those things are useful if you have dandruff. However, from a hair loss, purely hair loss point of view, bringaraj and saw palmetto, these are two herbs which have some degree of anti-male hormone property. That is when they get absorbed inside. Now, when we put oil, it's not going to go through the cells to the root of the hair. See, remember the root is quite deep. It's not just at the scalp level. So the oil is really not penetrating the root. Oil is penetrating the dead skin cells. It's a little bit penetrating the epidermis, the top level of skin. It's not going at a deeper level. So what is the method in which these herbal extracts can be introduced inside to give the clinical effect? That's separate function of research, and there are several prescription serums, even over-the-counter serums, which do contain saw palmetto, bringaraj, those properties, and they have the formulation is made for absorption, like liposomal formulation, and there are different types of formulation. However, the regular oil does not go too deep inside. So it does not convey the vehicle. However, there is absolutely no harm in oiling. It's just that, similarly, I mean, it's like there is no harm in taking that biotin supplement.
Understand.
It's not going to solve your problem, but there is no harm in taking it. It will help to some extent. So here,
Understood.
What I'm referring to is a balance in everything, a balance in not overdoing anything. If you are used to oiling, go ahead and oil. Don't change your habit. But if you want a specific oil, then go in for an oil which will have bringaraj, which will have saw palmetto, because they have, medically they are called DHT inhibitor. DHT is one of the type of androgen called dihydrotestosterone. So they will help reduce that hormone a little bit. So go ahead and do that. If you want to choose a herbal oil, go in for something which will contain those elements, and you could use it potentially to some extent. Like it will give you some benefits. A lot of small benefits would combine together. So go ahead and do it, but that's not the panacea of your hair loss treatment. What really hair loss treatment requires is a combined, a 360-degree approach. No one is going to solve it. Even clinic treatments, no one treatment is going to solve it. When you take, I have patients who say that, doctor, I've done this, I've done that, I've done this, I've not seen results. And the very same patients, we have seen that when we do a 360-degree work, where we are working on diet and lifestyle, we are working on nutrition, when we are working on the solutions and serums to apply, and work internally to that patient's customized body requirements, we get very, very good results.
Yes, I guess it comes back to there's no magic pill, and we need to look at the entire picture always for any part of health. So, okay, these are the common things that we do end up using, but would you recommend, what are the kind of topical treatments, let's say over the counter, like oil you said has a small role, maybe not, we don't know, but it won't harm. So you can.
Yeah.
But would there be any over-the-counter topical treatments that someone can at least get started with
Yeah.
before saying, I need to see a dermatologist?
Yes, there are things that you could start with. So if you start seeing thinning, you could use, so there are some peptides, peptide-based serums. Especially, there are these three peptides which are really found to have good results. One is Redensil, Procapil, and Capexil. There are these three peptides, and that combination, a serum which would contain at least 2 or 3% of Redensil, at least 1 to 5% of Capaxil, those type of serums, and you get these OTC, over the counter. So you start applying these serums. You apply it once a day at night time, put about 1 to 2 ml on your scalp, make parting, put drops and massage it in. Do this daily if possible, or at least 3-4 times a week. That would help. That, along with starting to take nutritional supplements, cyclical therapy, like, check your vitamin D, take those vitamin D supplements, check your iron levels, take iron supplements 2 or 3 times a week. Along with iron, take folic acid and vitamin C supplements. Take some omega-3 supplements and calcium supplements at least 3 times a week, not on the day of iron. Like, you take these, and that'll help. That'll help.
What if I've done all of this and I'm still experiencing hair fall? Is there a role for testing hormones, considering there could be a hormonal aspect as well?
Yes. So the thing is, a lot of hormones have close interplay between each other. So typically, I do test hormones. We have to rule out hypothyroidism. So we check thyroid hormones, we check prolactin hormone. Another very important hormone is your insulin hormone. Insulin resistance will secondarily increase your male hormone. Means if you have insulin resistance, your male hormones will slightly increase, and your male hormone effect, which is in this case the hair loss, can increase. So check insulin resistance levels. Now, insulin resistance is not equal to diabetes, and that is something that we really need to understand, because insulin resistance is kind of pre-diabetic level. So you have diabetes, you have pre-diabetes, and then you have insulin resistance before that. So insulin resistance, there is one test called HOMA-IR index, and I do recommend that to my patients, along with, of course, HbA1c, to check what are the sugar level averages. So we do that check. We check thyroid, prolactin, and if they've not attained menopause, I also check their AMH levels. So we check these tests and then see where we are. So assuming there's no thyroid, assuming there's no prolactin level abnormality or insulin resistance, then sometimes, if there is significant thinning, we do start our patients on what we call anti-androgen. Currently, there is a US FDA approved anti-androgen for postmenopausal hair loss called finasteride. So this is something which is commonly given for a little advanced degree of hair loss, which is perimenopausal and postmenopausal stage. But this is not something which is over the counter. This is something that your dermatologist can prescribe after understanding and assessing your case.
Right. And then, of course, looking at the whole picture, making sure everything else is taken care of. There's no, right. You often hear of the use of minoxidil. And what are your thoughts about using it, considering I think certain versions, certain formulations are available over the counter as well? Yes.
Yeah, minoxidil is being one of the oldest remedy for hair loss treatment, and it really remains effective until date. It's quite a useful remedy, and so minoxidil, typically, how does it work? It will open up the blood circulation. So it's what medically what we call vasodilator. It opens the blood circulation, and it is known to have stimulating effect for hair growth. So, in fact, it was discovered when it used to be in yesteryears be a hypertension medicine. It was given for high blood pressure, and those people who were on higher dose of minoxidil tablets as tablets, they started having increased hair growth, and that's how that whole compound evolved into being made into formulations which can be applied. So typically 2% and 5% minoxidil solutions are available in most countries over the counter. Now, the issue with minoxidil is actually there are two issues with minoxidil. One of the issue with minoxidil is where you cannot dissolve it in water. It's a substance which is alcohol soluble or some alcohol substitute, alcohol-free minoxidils or whatever. But when you apply it, it really makes your hair very dry and rough. So what happens is cosmetically, it's not elegant. So especially women who are going to their office daily, they're not able to wash their hair daily, and they are not comfortable. And because of that reason, a lot of time the compliance of applying minoxidil is not that good. And this is something that I've seen time and again, except for those cases where the hair loss is really increased to a level where they are applying irrespective of the cosmetic look. But early cases of hair loss, they are not able to apply daily because it really makes their hair very dry and rough. Now, there are minoxidil formulations, newer formulations which have come out, which may or may not be available over the counter in every place, but it can be tried and applied. So that's one issue, which is the cosmetic appeal. The second issue with minoxidil is rebound phenomenon. So if you've used minoxidil for a year or two, and then when you stop using it, there is that degree of rebound hair loss that happens. So hence minoxidil, if you're using, you should not suddenly stop it. You keep using it for some period of time, and then once you see your desired results, taper it very slowly. Don't stop using it. You need to maintain it. So you could look at say one day minoxidil, one day the peptide serum when you are tapering it off. So make it alternate days or maximum twice a week, but a little low dose you keep using so that you don't get the rebound hair loss.
Wow, that's yeah, I wasn't aware of that. That's quite some information, very practical. And okay, so as my first line, I have tried everything. I have now used topical solutions. I have tried using supplements, and let's say I'm nutritionally okay. Hair fall has stopped, but what do I do about the hair that's not growing back? Is it possible that if I've let it go for a while, we used to hear, oh, does the follicle really die? Is it not able to ever generate? Is that a possibility?
So the thing is, the follicle, yes, it can die and become very, very inactive, like so dormant that it can't be revived back. That is something that can happen. However, in most cases, we are able to revive back the follicle. Now, again, the time when we start treatment is crucial here. If you start treatment very late, then you are not able to revive the follicle so much. But if you start treatment at a little early stage where you've not really gone into the irreversible damage to follicle, I mean, it's not become so inactive that you can't revive it. Most cases we see, like I have seen personally around good 70 to 80% improvement in hair regrowth with treatment. But this involves a complete treatment. Right. So we use a combination therapy. So typically I would use a protocol of growth factor concentrate treatment, which is like a next generation PRP, platelet-rich plasma therapy. These are regenerative medicine treatment where we take your own blood in the lab, separate into a platelet-rich plasma, activate it, create growth factor concentrate, and use micro injections to inject those growth factors at the root of your hair. Wow. There are methods also which we can use, the methods which are minimally invasive or non-invasive methods. We work with a combination of those. That includes low-level laser light therapy, that includes no needle mesotherapy treatments, that includes a variety of microneedling dermapen type of treatments. So we combine treatments depending on what is needed for that particular patient. And you see really good amount of improvement. In fact, these days there are, sorry.
Good.
So these days there are newer regenerative medicine treatments which are being tried. One of them is exosomes. Exosomes are extracellular signaling molecules. So essentially, one cell has to communicate with other cell. So that cell will produce an exosome, which is a small little extracellular vesicle. Vesicle is a small, it's like a signal that the cell is sending out. So these days we are using exosomes for anti-aging, we are using exosomes for follicle health. But however, it's still new and still at a research stage. Then we use other newer factors, newer growth factors, lab-grown growth factors. These are growth factors which are, in fact, one of them got US FDA approval recently. So these are growth factors and peptide combinations. So they can be injected or using microinjections or microneedling treatments, it can be induced inside. So these are some of the treatments which can really work on stimulating your hair growth and can be revived. So what is really important is don't lose hope. It can be treated. It's not that, everything is gone and you have to just reconcile to the fact that there is less hair or there is no hair.
Right. And that is such a big thing because hair can play such a huge role in the psyche of a woman, right? You were telling me about how it's such a huge impact, more than skin is for a woman.
Yes, it is. Yes, it is. So the thing is, and I hear it a lot of time from my patients also, and I see it that, they say, doctor, if there is something on my skin, there's pigmentation, there's something, I can just put a concealer and I can cover. But if I don't have hair or my hair is thinning, balding and patches, then I don't know what to do. In fact, I've seen patients were just seeing that hair loss and thinning and gaps in between their hair actually can lead to depression. I have seen women getting into depression because of that. In the first consult, when I'm talking and we get into a detailed history taking to understand which are the possible hair loss accelerating factors. And then when we are discussing stress, there are so many of my patients who come and tell, doctor, I don't have any other stress. My stress is related to my hair loss. Wow. So you treat my hair loss, my stress is gone.
Wow. Well, it completely changes the way you look. Just having a haircut can completely change the way you look. So not having hair can of course play such a huge role. And the body's undergoing so much at that time. Our skin's change. So much is changing, especially at perimenopause for someone. And
yes, and the thing is, it all has a compounding effect. You are not finally feeling good. When you see in the mirror, you are not looking good. That makes you not feel good, so it kind of leads to a compounding effect. And see, also what has happened is over the generations, hair has been to some extent, this is at a whatever you can call collective conscious or subconscious level, that collective unconscious level or subconscious level, that there is that degree of association of femininity with hair. Typical impression of a female, I'm talking about not just, I'm talking about again at a societal conditioning over the years, is with good hair, thick hair, long hair, silky hair. You seldom see any female depiction without hair. Whereas for men, it's at some level acceptable to have balding. That is not so at a conditioning level for females. There are no acceptable bald role models for women.
That is so true. That is so true. But coming back to to using products, do you think, considering today's day and age, we've also exposed ourselves not only to environmental pollutants, but also pollutants in the sense the kind of products that we end up using, to look a certain way. Are there shampoos or products that women should be aware of, or then say, okay, I shouldn't be using these in my younger years, or if I've lost hair, do not use products which say XYZ? Like, would there be any advice with regards to that? That's like day-to-day products. And the second part is treatments that we undergo. Sometimes there's starting from the smallest things like hair color to things like keratin and all the wild stuff that's available out there. So yeah, if you could comment on these. Yeah.
Yeah. So, so basically talk about the day-to-day products. So typically we are talking shampoo, conditioning, hair mask, etc. So when we are talking about shampoos, see there are, okay, shampoos have been overrated in treatment of hair loss. No shampoo is going to treat hair loss because the hair loss is happening at hair root level, which is like deep inside. If this is the top level of skin, and then your hair is coming out from here and the root is here. So it's too deep inside for the shampoo to really penetrate and work at the root level. So shampoos do not cause hair loss, and shampoos cannot prevent hair loss too. And that's something that we need to understand. What shampoos do, they are the cleansers. They'll cleanse, they'll remove dirt, debris, oil, pollutants, etc. Now, like soaps and body washes, there are mild soaps and there are harsh soaps. Similarly, there are mild shampoos and there are harsh shampoos. So a milder shampoo would be a shampoo which would not deplete the scalp of all the oil, which will not cause dryness of hair. So that's a milder shampoo. And milder shampoo you can use frequently, like you can use it daily or alternate day without any problem. So some example of mild shampoos are sulfate-free shampoos. Now sulfates are cleansers, or shampoos are cleansers, and sulfates inside shampoos are cleansers. So if you have very oily scalp and you are continuously using a sulfate-free shampoo, your scalp oil is not going to get cleansed well. And that's what we need to understand. Now, of course, from a marketing point of view, free of anything is a big marketing claim. So from that point of view, sulfate-free shampoo market has burgeoned. So you have sulfate-based shampoos, which are your cheaper shampoos, and you have the little more expensive shampoos, which are your sulfate-free shampoos. And in general, sulfate-free shampoos are milder shampoos because the cleanser, the detergent component in that is milder. However, none of them are going to cause or help in hair loss, except for a little bit psychological benefit that we would have, what we call placebo effect. However, in general, if you're putting so many hair products, etc., like, I'm talking about products here, I'm talking about say minoxidil or serum or something, and if you have hair loss, you're using those products, it's a good idea to use a mild shampoo because then you are washing your hair more frequently. So you don't want your hair to come out all dry and frizzy, etc. And remember, already the male hormones are making your hair curly and frizzier, curlier, wavier. So already there is that propensity towards frizziness, dryness of hair. So in that, if you use a harsher shampoo, it'll make it more dry. It's not going to increase hair loss. It's going to make your hair a little more unmanageable, or it's not going to make it look nice or feel nice. Use a mild shampoo by all means, but use it knowing that that's not your hair loss solution. That's your hair cleansing solution. The second is that's not going to prevent your hair loss. Your prevention will happen internally from your food, from your supplements, from your water intake, from your exercise, all of that. So that is something that we need to differentiate. The hair cleansing products versus versus hair loss products. Now coming to the hair grooming methods in vogue. So we have hair color, we have keratin, cysteine, hair botox, etc., etc. So all of them would contain chemicals. And from time to time, all of us use it. Everyone uses it. In fact, one of my patients sometimes back told me, Doctor, I want hair so that I can use these things and look good. So the idea to you is not to stop doing all this. I want you to give me good hair so that I can abuse my hair and live with it. So typically, it's like it makes your hair look more blue. Yes, it is exposing the hair to a lot of chemicals, so we need to create again a balance. I mean, moderation. Do not go in for, so for example, hair color is if you are getting into hair loss, but you want to color your hair, you want to cover your grays, or you want to just color your hair, that's fine. Work on root strengthening and go ahead and color. Choose a color which is milder, which is not just ammonia free, but it maybe look at a PPD, paraphenylene diamine, PPD free or PTD free colors. Those are milder ones. Don't go in for things like bleaching or highlighting. If possible, your hair is damaged, please avoid that. The reason is because bleaching, highlighting, you have to remove the existing color and then put the new color. When you are covering your gray or when you are the regular hair gray coverage does not need chemicals which will take away the color from the hair. So things which are low chemical intensity treatments. So for example, rather than the actual hair straightening treatments, you could potentially go in for cysteine or keratin. It's not that it has no chemical. I mean, see, imagine now keratin, which is the protein of which nails and hair and the dead skin cells are made of. Now, this keratin, if you apply, what will happen? It's not going to stick, right? It's going to get washed out. So to make it stick to the hair, they have to use a chemical like formaldehyde or formaldehyde releasers, which will coat the hair with that. At least for those 3 months that it remains, it would need to coat the hair with that. So there is chemical despite of whatever marketing we are talking about. However, if you want to go ahead and do that, but don't do it at a stage where you suddenly have. So, I mean, I'll tell you a typical thing that happens. Someone starts losing hair, they start feeling very bad about their hair. So typically they would go to the parlor, they'll look at a haircut, they'll say do something, they'll say ma'am आपका बहुत frizzy हो रहा है, naturally because of the male hormone. So आपका hair बहुत frizzy हो रहा है, let's we'll do some keratin treatment. It's protein treatment, ma'am, there's no problem, do it. So go ahead and do it. Now, you exposing the hair to a lot of chemicals. The hair root is already weak. There is no nutrition going in. Hormonally, the follicle is shrinking. You expose more chemicals. There is more oxidative stress, and the root actually. I mean, I've seen cases where 2 to 3 months. So they said that I was still managing, but just 2 months back I did this keratin treatment, and since then my hair is just falling. Happens because we are damaging the hair which is already weak. So strengthen the hair first and then look at these things. I'm not saying that you don't do it at all, but make your hair root strong and then work with that.
Makes sense. And I guess the other treatments are also similar, as in you said keratin, but I guess there's cysteine and there's all these other things.
That's one of the examples I gave.
Yeah.
You see, there are different brands and different products, and each one has to differentiate themselves in the market. So, there would be a different name, there would be different, but in principle, these are certain types of proteins which are coated onto hair with certain chemicals. Heat. The chemical and the heat together will coat. And the coating will then last for 2 to 3 months.
Right. And I think that's the important thing. We wish to believe that it is just protein, and we wish to believe that there is no internal damage being done at that time of taking the treatment. But I guess marketing is a powerful tool, and how products are marketed in the there are buyers for these things because they're marketed well.
That's one. Second thing is it looks good, no? Temporarily your hair is looking very nice.
Yeah.
So
But then
the whole idea is they want the hair to look nice, so that's why they are going for it.
Yeah. But there is a beyond 3 months, what happens to my hair and what happens to me, and yeah, and I think there is just no money in live a healthy lifestyle. So
Yeah,
that's another problem.
that's really true. So the thing is, I mean, as simple as you taking supplements, okay, that's fine. But you look at your diet, you look at as simple as how much of water you are drinking. Really, how much of water you are drinking. I mean, water is such a basic requirement. It's such a base level requirement, but we are not getting enough.
And I would have not even thought about water. Like when if someone told me like top 5 things, I'd say, okay, look at your iron, look at B12, this, that, blah, blah. But water would have just not been one of my top 5.
Water is very important.
Yeah. Wow.
It is very important.
Yes.
Water requirement varies from person to person, but the thing is, water is really crucial.
No, that's really important advice. So I guess we've covered quite a lot of things. Would there be anything that you would like to share with us? Any myths or anything that we feel we have not covered in hair, especially in this age group of women?
So one thing I want to really share, I mean, more than a myth, what I really want to talk about is one, don't lose hope. I have seen patients who will be very sad, and there is that degree of sad acceptance, or some degree of that nothing can be done, I have to live with it. There is a degree of subtle depression about hair loss. So don't lose hope. It can be treated. That's one part. Second part is what will give you good hair is also what will give you good health and good life, which is your all the factors. So it's not when you're treating hair loss, it's not that you are just there are patients who will come to me say that I really want to treat my hair, and then I tell myself, the patient is telling me that I feel that should I be working so much for just hair, it's just vanity. So I tell myself that what you are doing for your hair is actually what you are doing for your health. You are taking a balanced diet, you are taking balanced nutrients, you are exercising, and then you are doing some local treatments to make your hair better.
Right. So basically, it's like this, the common sort of phrase that we use in in general health is do whatever you do to help your brain usually helps your heart health as well. So similarly, what basically the hair, the skin is reflecting ultimately your internal health, and by you're coming for vanity perhaps, but the bottom line is you're solving a deeper problem, and that is such an important message. That's great. That's so great to hear that, because we also tie like some amount of shame in vanity, right? Like oh, should I just be doing this for my hair? There's many more important things that I should be doing. But that's a great point to bring out. Thank you so much for sharing it.
One of my patients had once told me, the doctor, and she was really one of those patients, and she told me that she told me, the doctor, I don't spend on jewelry, I don't spend on too many clothes, but I would like to spend on my skin and hair. And she said, I'm not ashamed of it, I don't. And then I really learned something from that patient. I understood that we equate different things, I mean, different importance to different parts. Like, for some women, socially, buying jewelry is, they don't feel very guilty about buying jewelry or buying something specific to wear. I'm talking about wearing. However, doing something for your skin and hair, there is that social conditioning that's bad. I mean, spending smaller amount of money for that is bad. It's just a social condition. There's nothing right and wrong there. I mean, I was just when this patient told me this, and I was just reflecting, yeah, that there is really nothing right and wrong. It's a perception and it's a choice that they are making.
So true.
But if you look at it from that angle, when I wear certain type of clothes that I would want to wear, that's also vanity. When I'm wearing certain type of jewelry or I'm living my life in a particular way, that's also vanity. As much as if I'm looking after my skin or if I'm looking after my hair.
So true. So true. No, but it's not like having a bypass done, right? If you say getting a bypass done, then there's you're definitely using your money well. You know, that's just, I'm not saying that that's a fact, of course not, but the point is that I guess for the general population, that can be an attitude that it's not, I'm not spending on my skin, it's not superficial, it's a requirement, you need it, it's not a luxury. So yeah, but that's a great thing
I
to
would
share.
say, how do you want to project yourself?
True.
I mean, it's like, all of us would have a different choice of clothing. And there's nothing good or bad. It is all dependent on how would you like to project yourself in your mind, in others' mind. So how would you project your hair or project your skin is also part of that.
Well, that is some wisdom to take away. This is where your other interests have come in, right? Not specifically being a dermatologist and trichologist, but your interest in life and in spirituality and in connections and mind-body connections. And I think that really adds value to what you have to say, because it's not just tunneling down the prescription road. It's about how does one perceive themselves, and thank you for sharing that. So coming to the end of this episode, it's been so amazing. Actually, I can go on for another couple of hours, but probably too long for to take away so much of your time. But if you could give us 3 essential tips to walk away with, what is it that you would advise women? Just 3 tips on taking care of their hair and limiting hair fall or preventing it around this age of perimenopause and menopause.
So the first tip would be to start early. Start looking after your hair early. Look at your hair and see if you see any thinning, if you feel that I had straight hair and now it's turning a little frizzy or wavy or something, which is a sign that something is not going right. And seek treatment, seek consultations early. Start treatment early before you lose your hair. So that's one advice I would really, one suggestion that I would really leave it out there in open. Second part is that's something that we had discussed. Balance is what is really important. A balanced life would lead to balance of your health and would lead to balance of your hair. So create that balance. You want to go in for hair grooming method, create a balance, moderation. You want to, if you are looking at exercise, okay, even exercises, create a balance. I have seen patients who go overboard, huge amount of gym supplements, a lot of exercise, and then what happens is exercise is not bad, but I'm talking about a lot of gym supplements. What happens is there are a lot of anabolic proteins which are going in. What happens? That will increase male hormone. That will create its own set of problems. So moderation and balance is really the key one. And in all areas. So start early, create a balance in your life. See what makes you feel better and create a balance around that. And the third part is really look after your nutrition and water intake. Water is a really important aspect, along with nutrition, which is your omega-3, your protein, your iron, and calcium, those supplements.
Oh, wonderful. Wonderful. So, once again, thank you so much for today. And we've come back with such a bag of useful information. I'm sure this is going to benefit a whole load of women who are looking at their hair thinning. And at least they can get started at home and get started with the basic stuff. Let's get started with the small stuff before we reach a place where we need bigger treatments. So, once again, thank you so much, Dr. Sriram. It's been such a pleasure chatting with you.
My pleasure. It's a pleasure being here. It was nice talking to you. Thank you so much for inviting me here.
Thank you.
And all the
Thank you. Bye-bye.
best to everyone.
Thanks again for tuning in to MenopauseWize. Stay informed, stay empowered, and I'll see you in the next episode as we continue to navigate the menopause journey together. If you're a healthcare provider interested in collaborating with us or have insights to share, we'd love to hear from you. Please email us at info@menopausewize.com. That's wise with a Z. And before we go, a quick medical disclaimer. The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult your physician or a qualified healthcare provider before making any decisions regarding your health or any medical treatments discussed in this podcast. While we strive to provide accurate and up-to-date information, this podcast does not replace professional medical consultation, diagnosis, or treatment. If you have any concerns or symptoms that require medical attention, please seek advice from your healthcare provider.